It's time now for the Business of Health, brought to you by Hendricks Regional Health. Well, an Indiana company is the first in the world to commercialize a device to help relieve the symptoms of opioid withdrawal. Versailles-based Innovative Health Solutions says the inability to endure withdrawal symptoms prevents many people from overcoming opioid addiction. And Inside Indiana Business reporter Kylie Valletta joins us now with more. Kylie.
Thank you very much, Gary. Innovative Health Solutions says the first days of withdrawal are so painful and debilitating that many go back to using opioids within hours. The company's device, the NSS-2 BRIDGE, is the first device for opioid withdrawal to earn FDA approval. And that happened just weeks ago. And Brian Carrico, president of Innovative Health Solutions, joins me now. Brian, thanks for being here today.
Thank you for having me.
So tell us about this device in layman's terms. What is it and how does it work?
So the device is called the NSS-2 BRIDGE, and this is a peripheral nerve stimulator. And what it is the device the size of a USB that's placed behind someone's ear, and then there are 3 electrodes that go on the side of someone's head that pierce the skin. They break the skin. This is not a painful procedure, and the electrical current from this technology accesses the brain and essentially blocks the part of the brain that fires these miserable withdrawal symptoms. So there's a part of the brain that causes the pain, the sweating, the nausea, the vomiting, and this device, in layman's terms, blocks that part of the brain to prevent these opioid withdrawal symptoms. And all of the research shows an 85% reduction in symptoms in less than 1 hour. And the device runs for 5 days, which in most instances is enough time for the patient to get the opioid that they are taking out of their system so they can move on to treatment and recovery.
So the biggest hurdle right now for your company is patients trying to pay for it, $600 out of pocket. And then you said also the procedure can cost money on top of that, so it can be up to $1,200 all in. So how is your company trying to help overcome this hurdle?
Sure. So we're working with the states currently, and we have been aggressively working with the states since November 15th when we got the approval. And we have multiple states in the country that have verbally told us they're very close to approving this. We expect several states to begin to cover this in the month of February, and we have a policy team in place that work with these states. Once that happens, the states will have covered this technology, and then the doctors will be able to bill an evaluation management code. And the cost really can go anywhere from $700 to $1,200 depending on the type of physician and who they're actually seeing and how much time the physician spends. We also are working with several different commercial insurance carriers to get this covered. But this is a process. It does take time, and we're working with them as we speak. But we do expect coverage to start coming through in multiple states this month.
And how is that process going here in Indiana?
We're working with Indiana. We're in process. I'm told that the process is moving along as it does. I know it's a 4 to 6 week process for them just to get through it, and we submitted mid to late December, so I'm expecting in the next week or two to have a meeting with Indiana to find out if coverage has been accepted or if we have some other things we have to do with the state.
Okay. And we talked about Indiana, and its rural communities seem to be really hit the hardest with opioid abuse. So getting them through that withdrawal and on to treatment, what could that mean big picture for these communities?
Well, number one, the most important thing about this device is it's an outpatient procedure so that patients in rural communities can actually get this. We all know in the addiction world that the biggest hurdle in the continuum of care in addiction is the opioid withdrawal period. There's always been help for other parts of this disease, but for the withdrawal period, to our knowledge, there is no other approved technology or drug for this. So in the rural communities, that now allows someone to get help, go home, come back and get treatment. And this allows people in the rural communities to get back to work. It allows people in the justice system, instead of going to jail, they now can get the bridge and treatment and recovery.
And also worth mentioning that this is manufactured in Jeffersonville at Key Electronics. You're headquartered in Versailles, but you also have a new location in Carmel.
Yes, so our headquarters are in Versailles, manufacturing in Jeffersonville, and then we have an office here in Carmel, Indiana. So we're an Indiana company.
And this is just the first application, you say, for this device. There are many more.
We do have research underway in about 10 different diagnoses, including post-op pain at Duke University, along with other universities. And we're hopeful in the next 12 to 18 months we have additional indications.
All right. Well, Brian, thank you very much for joining us today. Please keep us posted as the device moves along.
Thank you very much.